Now let's talk about the PACS acquisition rate. The PACS acquisition rate definition is the rate at which studies are received from the various modalities measured over a specific period of time. For example, it could be the number of studies received in an hour, a day, or a month. Okay, so how many CTs did we get between 1 p.m. and 2 p.m. today? Acquisition rate. How many studies are coming in a particular time frame? The image acquisition gateway. An image acquisition gateway is also called a DICOM server response to modality DICOM storage requests. The gateway has three primary tasks. It acquires the images from the modalities. It converts the data from the modality-specific format to the PACS standard format, including header format, byte ordering, and matrix size. 3. It sends the images to the appropriate PACS storage location. So I want to talk about 2 for just a second here. It's not going to change any of the data. It's just going to change the format. Some data comes with certain DICOM tags from the MRI or the bone density, and it's just going to reorder those DICOM tags into the standard format that PACS uses. It's not changing the data. It's not altering the data is a better way to say that. It's just taking the data in one format and putting it into another DICOM format. That's all it's doing. Image Acquisition Gateway is a DICOM SCP, Service Class Provider for Image Acquisition and Storage. The Image Acquisition Gateway has the following characteristics. It preserves the image data integrity transmitted from the imaging device. 2. Its operation is transparent and automatic. 3. It delivers images in a timely manner to PACS storage. 4. It performs some image preprocessing functions to facilitate image display. So, 1. It preserves the image the way it came from the modality. 2. It doesn't require manual intervention from humans. It just does its thing. 3. It works as quickly as it possibly can. And 4. It will do some preprocessing functions to facilitate image display. And I'll explain that 2 slides from now. So, PACS does not change the image quality. Technologists will always say things like, oh, my images always look darker on PACS. My images always look lighter on PACS. Oh, my images look this way on PACS. It's just their perception. It is not reality. It's just because they took a crappy image. They want to blame it on the technology. Please note that first and most important characteristic of the acquisition gateway is to preserve image data integrity transmitted from the imaging device. Let me go back up. Number 1, preserves image data integrity. So, it preserves the image data integrity transmitted from the imaging device. In other words, it doesn't change how the image looks. If the image was too dark or too light when it was created, it will be too dark or too light on PACS. Any variation between how the image looks on PACS and how it looks on the tech review station should only be a matter of different monitor quality and calibration. That's the only reason it should look different when it's looked at in PACS versus looked at the tech review station. And the only preprocessing function that should happen to an image performed by the acquisition gateway is how the image is oriented. The only thing it should do is flip it around so it's the right way. How many ways are there? I'm so glad you asked. There are 8 possible orientations of an image. And so we're going to use this chest x-ray to give you the 8 possible orientations. So, in orientation A, the patient is upright facing towards us. So I know from the shadow of the heart and the position of this NG tube, that little white up and down line, hopefully you can see that on the screencast, is a nasogastric NG tube. NG stands for nasogastric. It's a tube that starts in their nose and goes down into their stomach so they can feed them or take things out of the stomach if they need to. So by looking at the heart and the NG tube, I can see that that patient right now is upright looking towards me. By using the position of the heart and the NG tube, I can see that in figure B, the patient is facing towards me laying on their left side. In figure C, the patient is facing towards me upside down, and in figure D, the patient would be laying on their right side facing towards me. In figure E, the patient would be upright with their back to me. So if you look closely, you'll see the heart is now flipped around the other way, and the NG tube is on the other side, which lets me know that the patient is now facing away from me. In figure F, the patient is lying on their right side facing away from me. In figure G, the patient is upside down with their back to me. And in figure H, the patient is laying on their left side with their back to me. So facing me 4 different ways, back to me 4 different ways. Those are the 8 possible orientations of an AP chest. And pretty much every body region has those same 8 possible orientations. So if an image comes from the modality and it's not oriented facing me upright, if it's not in A, PACS will move the image around so that it becomes A. So if you send C from the modality, before PACS stores it, it will turn it into A, so it's facing the correct way. That's the only pre-processing function most PACS will do. So, the acquisition gateway, also called the DICOM server, and I will call it the DICOM server most of the time, sits between the modalities and the archive in most PACS workflows. So this is a whole generic picture of the PACS workflows, but most importantly, you have the imaging modalities here. They send to the acquisition gateway, what I call the DICOM server, which then talks to the server and archive and stores the images that way. I'm going to stop this here and continue on because I'm really trying to keep these lectures down to 5 minutes whenever possible, and this one's going to hit 7, so I'm going to stop here.